A patient comes into the emergency room and they have a blown pupil on this side. What do you think is going on with the patient?
A blown pupil on one side could indicate increased intracranial pressure.
What is the emergent intervention that we can do at bedside to relieve some of this pressure?
Prepare for potential interventions like a ventriculostomy.
That is correct. You are the neurosurgeon. What is the first step?
Identify the appropriate entry point. Typically, this is Coker's point, 11 centimeters posterior to the glabella and 3 centimeters lateral to the midline.
Is that the glabella?
No, that's not the glabella. You are pointing at the upper cheek area.
Is this the glabella?
Yes, that is the glabella. It's the smooth area above the nose and between the eyebrows. Measure approximately 11 centimeters back from the glabella and about 3 centimeters lateral to the midline to find Coker's point. This is where you'll drill the burr hole.
Does this look like Coker's point?
Yes, that looks correct for Coker's point.
The patient is prepped and draped and the incision is made. What do I do next?
Carefully drill a burr hole through the skull.
I drilled the hole, and what should I do next?
Next, insert the ventricular catheter through the burr hole at the proper trajectory, usually aiming towards the ipsilateral frontal horn of the lateral ventricle.
Does this look like the correct trajectory?
Yes, that trajectory looks appropriate. Once you reach the ventricle, you'll see cerebrospinal fluid return.
Does this trajectory look correct?
That trajectory looks correct. Once the catheter is in place and you see cerebrospinal fluid, secure it. Then connect it to the drainage system.